new emergency department that is going to exist. And so I'd like to introduce members of our team, Dr. Chung, who is our chair of our emergency services here at Interfaith Medical Center, and Donna Green, who is our senior vice president for planning and actually our key person who's working on our Kings County Transformation Grant, which is one source, just one source of the funding for the emergency department. But most importantly, we're here to celebrate that our Congress member and our senator have blessed us, frankly, with providing additional funding so that we can complete the multi-phases of this very, very important clinical services for our community. And so with that, I will step out of the way and I will let Dr. Chung talk a bit about what our current emergency department is, the number of people we serve, the number of visits we have, the fact and the range of services that are provided in what we now have of a too small, too old emergency department. And then Donna Green will also speak to what you see on the big boards. Thank you very much.
Good morning, everybody. So, our emergency department at Interfaith serve approximately 40,000 people a year. And out of those, about approximately 13 to 15% of those patients, depending on a year, is broken down to the psych patients that we actually see. And on top of that, we also take care of patients that require detox. And we have a detox unit upstairs on one of the floors. And we also serve the pediatric patients that come to the emergency department. Currently, the size of the emergency department is really, like Ms. Brown said, really small. There's really not a lot of private rooms for patients. And there really is not, and even the equipment that we have has been there for many, many years. And we're so happy that we're getting this grant and this money because we needed it for our community, really. Our community deserve it. And we're so happy that we're able to share this with you guys today. I hope that we're going to continue to use this to serve those that actually have not been here before. Once we have a brand new ED, we're going to have more people coming in, and hopefully we can actually increase our volume in the emergency department and serve more people in this community.
Wonderful. Thank you, Doctor. Donna, you do want to briefly, just for those who are taking the pictures, to show what they're looking at, in as much as not everybody can walk through the emergency room because of patient privacy, etc.
Good morning. To my left here is the 4 phases of the emergency department modernization and expansion. The red area towards the bottom is our psychiatric emergency department. That project is in progress right now, and it ends in July. And so we'll have a new psyche emergency department. You will see at the bottom here the future state, some of the areas. So right now, and actually in front of Dr. Chung, when you look at those, right, towards the bottom, you'll see a secure holding area where it's just, a room. Here in the secure holding area, you see that there is a television, and, we can play music, we can show things that will help to calm our patients. We also will have more of a waiting area, and this area will be right in the emergency room, so we don't have to transport patients to another area. And just as Ms. Brown was saying earlier, this work included completely gutting a certain area, expanding it, and also putting in new utilities, new oxygen, med gases, and also all of the infrastructure. So
great. That's awesome.
That's our
and
new
what is
area.
this one to show us?
Okay, so then we go to phase 2, which will start in July, which through the thanks of our senators and the leader here, we have with this new area will deal with our trauma area. So if you look at that picture down there, that very packed trauma area, so imagine someone needing trauma services and doctors are having to jump all over the place in order to take care of the person. Now we will have this area here, this future area, which is larger, which allows this appropriate circulation. If you look at that green area there, sort of in the middle here, shows the flow into the trauma area. So this this modernization piece allows us to have better flow for patients and staff to get to that area. So we are very, very, very grateful for the support for that area.
Wonderful.
Okay.
Wrap up the final
Okay,
phase.
and so the final two phases, so 3 and 4, you'll see these here, and these get to our waiting areas. We had community focus groups come in and tell us what they needed, and Ms. Brown had mentioned we need, a certain area for children. We need a specific area for children. So we have now a pediatric waiting area and an adult waiting area, so kids can be, and their families can be together. And it'll also, we have vertical care areas. So not everyone needs to be lying down on a stretcher when they come in an emergency room. And so this will allow us to, have, asthma care or other care for conditions that don't need you to be lying down. It takes up less space, allows us to care for more people.
But I think what's incredibly important is that what One Brooklyn tries to do, we work very hard at it, we're not perfect.
We're coming from the microphone.
Thank you.
To the mic.
What's really important is what we try to do at One Brooklyn and Interfaith Medical Center is to actively engage our community in our current activities, but also our future plans. And so we hosted a series of focus groups with members of the community, some members of our board, members of the community planning boards, some representatives from our elected officials, to say, what are we doing now that we can improve upon? How do we leverage these grant dollars to give you what you want? And that informed the design of this new emergency department. And so we hope that our community will be proud of the work when it's finished. And I never want to have more people come to an emergency department. What I want, however, is when they do come to the emergency department, that we are serving them with respect, that we are providing them with the great services that we already do, but that our staff can do their great work in environments that are conducive to them being as effective as possible, and that are comfortable for our families and our children. So thank you all very much. And so now I'd like to introduce Leader Jeffries, a stalwart supporter of One Brooklyn Health and Interfaith Medical Center. And I just can't say enough about Hakeem Jeffries in terms of his support for all of his constituents in Brooklyn, and particularly for health care services. So, Leader Jeffries, I'm stepping aside.
Good morning, everyone. Good morning. What an honor and a privilege to be here with you, Lorraine and Alex, our tremendous board chair, and of course Reverend Waterman and vice chair, and Maurice, all the distinguished members of the board, the healthcare heroes. We're thankful for the doctors and the nurses and the providers, for all who, under Lorraine's great leadership, provide tremendous care for the people of Central Brooklyn here at Interfaith Medical Center. I'm certainly thankful for the tremendous leadership and partnership of Senator Gillibrand and, of course, Senator Myrie, who you will hear from momentarily. The One Brooklyn Health system provides tremendously important care to tens of thousands of individuals, if not hundreds of thousands of individuals here in Central Brooklyn, in communities that have traditionally been under-resourced. In terms of the emergency care in a community that suffers from disproportionately high rates of many chronic illnesses, it is critically important that the healthcare heroes here at Interfaith Medical Center and across the One Brooklyn Health system have the ability to do their tremendous work in the most modern environment possible. People here at Interfaith have been providing high-quality, compassionate care, 21st century care in 20th century infrastructure. And so what the modernization of the emergency department will allow is for the people here at Interfaith to provide that 21st century care in a 21st century environment. And that's why we, Senator Gillibrand, myself, Leader Schumer, worked hard to try to secure some additional federal resources to enable the people here at Interfaith to continue your work, to be there for individuals that we're privileged to serve in their time of need, particularly when they are confronting a health care crisis. And so, over the last year or so, we had the opportunity finally to try to designate a handful of community-based projects for additional federal assistance that we deemed as important in the quality of life for the people that we serve. And so thankfully, in this most recent spending agreement in December, with the leadership of Senator Gillibrand in partnership with myself and Senator Schumer, we were able to secure for this emergency department work an additional $3 million in federal resources. And we're proud to announce that today and to bring those resources home to the community. At the same time, as our discussion revealed earlier this morning, we're going to continue to work for structural change to make sure that safety net hospitals who care for the most vulnerable amongst us can receive the additional resources necessary to be able to continue the great work that you undertake on behalf of our communities. And I know Senator Gillibrand and I, at the federal government level, and Senator Myrie at the state level, are committed to making sure that we can bring about that structural change so that safety net hospitals, such as the ones that are part of the One Brooklyn system, can receive those resources. And that is our commitment to you. Let me now yield to our distinguished senator, who's been a friend of this community, a leader for the state, a champion for the least, the lost, and the left behind, for the poor, the sick, and the afflicted. I won't go through the whole alphabet, y'all. But I could, because that is the type of leader that Senator Gillibrand has been for us, and it's my honor now to yield to our great Senator, Kirsten Gillibrand.
Thank you very much, Leader. Well, we are blessed with so many amazing leaders here in Brooklyn. Leader Jeffries is going to be the Speaker of the House someday, and we are very proud of him for his leadership here in this community, but his leadership for the whole state and the whole country, and it's a real blessing. I want to thank Lorraine Brown for her leadership and her vision. This is a vision, and your advocacy and your presence and your determination to get us where we need to go is exactly the kind of inspiration that your elected leaders need so that we can implement your vision, get the resources, make the structural changes necessary. So thank you for being our leader. I want to recognize the other leaders here among us. I want to thank our chairman of the board, Alex, for his very persistent work and for his determination to meet the goals and the needs of this community. To our hospital leaders, our doctors, to our board members, thank you for the work you do to make this hospital network thrive. Without you, it wouldn't happen. So this is really a community effort, and I'm very, very privileged to be part of it. I think what we've heard today is about what we need to do to help those most in need, to help these critical care and safety net hospitals, to make sure that patients here get the same care that any patient anywhere in the state gets, to make sure that they have the resources and the facilities that meet their medical needs. And so announcing this $3 million today is extremely exciting because it just helps facilitate these changes for the emergency room that, as you can see, will just be able to provide better care to patients who are having emergency episodes. This is very important for the health care and well-being of this whole community. This hospital is one of the most important safety net hospitals of the region, with 50,000 annual visitors into this emergency department alone. It shows the need. It shows the extreme need and the burdens placed on this facility that need to be met with more resources and more ability for them to be able to meet those needs. We've seen our frontline and safety net providers really carry the weight of the last 3 years. This pandemic has not been easy on safety net hospitals. We know that a lot of our communities who have been underserved come in with worse medical conditions and worse medical outcomes because of decades and decades of lack of investment into their community, into their well-being, and into healthcare for them and their families. And so helping the safety net hospitals that helped us in our greatest time of need is our highest priority. And I'm very excited to work with Leader Jeffries on solutions, long-term, structural solutions that can help safety net hospitals provide for the people they need. I also want to recognize our state champions because without amazing state senators like Zellner Myrie to carry the charge in the, not Congress, in the Assembly and State Senate for our state government, we wouldn't get this done either. We have state solutions that our senator is working on that is very profound and important, working with our governor to try to change how we receive our reimbursements here in the state. I think that's really important work, and certainly the congressman and I will lift up that advocacy so that you can be successful and you can create the momentum that's needed to change laws. So thank you for letting me be here. I'm now going to introduce, did you want us to say a word? You should. Zellner Myrie.
Thank you. Let me express my deep gratitude to our Senator Gillibrand, and to Leader Jeffries for their federal investment in this institution. During the height of the pandemic, a lot of us stood outside. We applauded our healthcare heroes. We banged on pots and pans. And then the pandemic abated, and that same level of enthusiasm also faded. And so I'm really grateful that our federal partners are here today saying that we are worth it. We are valuable. And it's not just about an applause. It is putting your money where your mouth is. And also, selfishly, I was born in this hospital. So I am...
I was thinking Congressman Jeffries born in this, why he was talking.
Yeah, so I am very selfishly grateful for this investment. Our community thanks you, and thanks Lorraine and the entire team here for their leadership at this moment. Thank you.
Thank you. Thank you all.
Wonderful. Now I think the moment that we have been waiting for.
Yes.
And Lorraine, come in the middle so Senator Gillibrand and I can present it.
We can do it in front of,
Okay,
in front of the, so they get in the picture. Can you guys refocus? Lorraine, get your hand on that. That's your check. That's right.
This is a check.
And the real check is coming home.
If we could get some of our board members to
Get in the picture.
get in
Come
the
on.
picture, please.
Pastor Waterman, get in, get in. Thank you, guys.
Our chief medical officer is back there, Dr. Stevens.
Yeah, come on in. And let's put it down a little bit because we have shorter. There we go.
Our director of psychiatry, get over here, Jason. Everybody's part of the team.
This is the celebration picture.
That's right.
Thank you. Thank
Thank
you,
you, and
everyone.
keep up the great work.
Thank you, everyone. Congratulations.
Thank you.
Good to see you. Thank you so much. Thank you so much. Appreciate it.